Hypertension, commonly known as high blood pressure, affects millions of people across the globe. It is one of the most widespread chronic health conditions, often going undetected due to its subtle symptoms. The prevalence of hypertension continues to rise, impacting both developed and developing countries. As a leading risk factor for heart disease, stroke, and kidney failure, hypertension poses a major challenge to public health systems. Addressing this condition is crucial for reducing the burden of serious health complications worldwide. Hypertension, commonly known as high blood pressure, is a medical condition where the force of the blood against the artery walls is consistently too high. Diagnosis is typically made when a person's blood pressure readings are at or above 130/80 millimeters of mercury on multiple occasions. Blood pressure is categorized into stages. Elevated blood pressure ranges from 120 to 129 systolic and less than 80 diastolic, while Stage 1 hypertension is defined as 130 to 139 systolic or 80 to 89 diastolic. Stage 2 hypertension occurs when readings are 140/90 or higher. Recognizing these stages is important for guiding treatment and reducing the risk of complications. Hypertension, or high blood pressure, is generally classified into two main types, primary and secondary. Primary, also known as essential hypertension, accounts for the majority of cases and develops gradually over time without a specific identifiable cause. In contrast, secondary hypertension results from an underlying condition, such as kidney disease or hormonal disorders, and can appear suddenly. Understanding the distinction between these types is important, as it influences both diagnosis and treatment approaches. Several key factors contribute to the development of hypertension. Age is a significant risk, as blood pressure tends to rise naturally as people get older. Genetics also play a role, meaning a family history of high blood pressure can increase an individual's likelihood of developing the condition. Lifestyle choices, such as a diet high in salt, lack of physical activity, and excessive alcohol consumption, further elevate the risk. Additionally, the presence of other health conditions, like diabetes or kidney disease, can make hypertension more likely. Hypertension, or high blood pressure, develops when the mechanisms that regulate blood pressure become imbalanced. Normally, blood pressure is controlled by a complex interaction between the heart, blood vessels, kidneys, and various hormones. The heart pumps blood through the arteries, and the resistance these vessels provide, along with the volume of blood, determines overall pressure. The kidneys help regulate this by adjusting the amount of fluid in the body and releasing hormones that influence vessel constriction. When these systems are disrupted, due to genetic factors, lifestyle, or disease, blood pressure can rise and remain elevated, leading to hypertension. Hypertension, or high blood pressure, is often called the silent killer because it typically develops without obvious symptoms. Many people may not realize they have it until serious complications arise, such as heart attack, stroke, or kidney damage. When symptoms do occur, they can include headaches, dizziness, blurred vision, or nosebleeds. But these are uncommon and usually appear only when blood pressure reaches dangerously high levels. This lack of warning signs makes regular monitoring essential for early detection and management. Uncontrolled hypertension can have serious consequences for the body. Over time, persistently high blood pressure puts extra strain on the heart, increasing the risk of heart disease and heart failure. It also damages blood vessels, which can lead to strokes and impair blood flow to the brain. The kidneys are particularly vulnerable, as hypertension can cause lasting damage and potentially lead to kidney failure. Additionally, high blood pressure may harm the delicate blood vessels in the eyes, resulting in vision loss. Diagnosing hypertension relies primarily on measuring blood pressure using a reliable and standardized method. Blood pressure is typically assessed with a sphygmomanometer, either manually or with an automated device, while the patient is seated and relaxed. Multiple readings are often taken at different times to ensure accuracy, as factors like stress or recent activity can temporarily elevate results. Accurate measurement is crucial, as misreadings can lead to incorrect diagnoses and inappropriate treatment. Proper technique and calibration of equipment help ensure that blood pressure readings truly reflect a patient's cardiovascular health. Lifestyle modifications play a crucial role in managing and preventing hypertension. Adopting a balanced diet that is low in sodium and rich in fruits, vegetables, and whole grains can significantly lower blood pressure. Regular physical activity, such as brisk walking or cycling, helps maintain a healthy weight and supports cardiovascular health. Additionally, managing stress through techniques like meditation, deep breathing, or yoga can further contribute to blood pressure control. Together, these changes create a strong foundation for long-term heart health. Pharmacological treatment of hypertension involves several classes of medications, each working through distinct mechanisms to lower blood pressure. Commonly prescribed antihypertensive drugs include diuretics, which help the body eliminate excess salt and water, reducing blood volume. Beta blockers decrease heart rate and the force of contraction, while calcium channel blockers relax blood vessels by preventing calcium from entering muscle cells in the vessel walls. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, and angiotensin receptor blockers, known as ARBs, both act to relax blood vessels by interfering with the effects of angiotensin, a hormone that narrows arteries. These medications are often selected based on individual patient needs and may be used alone or in combination for optimal blood pressure control. Regular monitoring and follow-up are essential for individuals living with hypertension. These practices help track blood pressure levels over time, allowing for timely adjustments to treatment plans if necessary. Consistent check-ins with healthcare providers can also identify potential complications early, reducing the risk of serious health issues. By staying vigilant and proactive, individuals can better manage their condition and improve their overall well-being. Preventing hypertension requires a combination of personal choices and broader community efforts. On an individual level, maintaining a healthy diet, engaging in regular physical activity, and avoiding excessive salt and alcohol intake are key steps. At the community level, public health initiatives play a vital role, such as promoting access to nutritious foods, creating safe spaces for exercise, and running educational campaigns about blood pressure management. These strategies work together to reduce the overall risk of hypertension and support healthier populations. By addressing both personal habits and environmental factors, communities can make significant progress in preventing high blood pressure. Hypertension, or high blood pressure, is a common condition that often develops without noticeable symptoms. Yet it significantly increases the risk of heart disease, stroke, and other serious health problems. Key factors contributing to hypertension include genetics, lifestyle choices, and underlying medical conditions. Regular monitoring, a balanced diet, physical activity, and adherence to prescribed medications are essential for effective management. Raising awareness about hypertension empowers individuals to take control of their health. Proactive management and early intervention can make a meaningful difference in preventing complications and improving overall well-being.